Ever wondered about the common misconceptions of ibuprofen usage? Ibuprofen, an over-the-counter nonsteroidal anti-inflammatory drug, or OTC NSAID for short, is commonly used for relieving inflammation, fever and mild pain. It's the go-to solution for many when discomfort strikes. It's the familiar pill bottle in our medicine cabinets, and it's easy to think of it as completely safe because we can buy it almost anywhere. But just like any medication, it's not without its potential dangers. The misconception that it is entirely safe because it's readily available is a dangerous one. It's important to remember that even though it's sold over the counter, it's still a drug with potential side effects, especially when not used as directed. Just because it's readily available doesn't mean it's entirely safe. Let's dive in to understand more. Taking too much ibuprofen can lead to an overdose, but what does that mean, you might ask? Well, let's delve into the darker side of ibuprofen, a widely used over-the-counter non-steroidal anti-inflammatory drug, or NSAID for short. Firstly, an ibuprofen overdose can result in damaging side effects, most notably to your stomach and intestines. You see, ibuprofen, like any NSAID, is designed to reduce inflammation and relieve mild pain. But when consumed in excess, it can wreak havoc on your digestive system. It's a bit like using a sledgehammer to crack a nut. The force is simply too much for the delicate internal structures to handle. In severe cases, this damage can lead to life-threatening conditions like gastric ulcers and internal bleeding. Picture this: instead of your stomach breaking down food, it's being eroded by the very medication meant to alleviate your pain. It's a grim picture, isn't it? But the risks don't stop there. In rare cases, an ibuprofen overdose can even be fatal. This isn't to scare you, but to underline the importance of responsible medication use. It's easy to think that because ibuprofen is available without a prescription, it's harmless. But that's far from the truth. Like any medication, it has the potential to harm as much as heal if not used properly. So, how can you avoid these dangers? The key lies in adhering to the recommended dosage. For adults, this typically means 1 or 2 200 milligram tablets every 4 to 6 hours, not exceeding 800 milligrams at once or 3,200 milligrams per day. Remember, more isn't always better. When it comes to medication, the right dose can mean the difference between relief and risk. The risks of overdosing are real and serious. It is crucial to stick to the recommended dosage, because when it comes to your health, it's better to be safe than sorry. So, what is the recommended dosage for ibuprofen? Well, let's dive into it. Ibuprofen is a common non-steroidal anti-inflammatory drug, often found in our medicine cabinets at home. It's used to alleviate inflammation, fever and mild pain, but as with any medication, there are guidelines to follow in terms of dosage. For adults, the recommended dosage is 1 or 2 200 milligram tablets every 4 to 6 hours. It's crucial, however, not to exceed 800 milligrams at once, or a total of 3,200 milligrams per day. Going beyond these limits can lead to an overdose, which can result in dangerous side effects. The scenario is a bit different when it comes to children. Their dosage isn't a one-size-fits-all figure like it is for adults. Instead, it's determined based on their weight and the specific formulation of ibuprofen being used. It's always recommended to consult with a healthcare provider to ensure the correct dosage for your child. Remember, exceeding the recommended dosage isn't a case of more is better. In fact, it's quite the opposite. Taking more than the recommended amount can result in an overdose, leading to harmful and in some cases fatal consequences. The concept of dosage is not to be taken lightly. It's a balance between relief and risk. It's about finding the smallest effective dose that will provide relief without putting your health at risk. So, always read product labels carefully, and if in doubt, consult with your healthcare provider. And remember, just because ibuprofen is available over the counter, it doesn't mean it's free from risk. Remember, exceeding the recommended dosage can increase your risk of overdose and harm. How can you tell if you've overdosed on ibuprofen? As we delve deeper into this topic, it's crucial to know what to look out for. Ibuprofen overdose doesn't come with a flashing warning sign. Instead, it manifests in a range of symptoms that vary from mild to severe. On the milder end of the scale, you may experience nausea, vomiting, stomach pain, or even a ringing in the ears. These symptoms may seem commonplace, but they're your body's way of telling you that something's not right. However, the severity can escalate, leading to more alarming symptoms such as dizziness, rapid breathing, or even loss of consciousness. In extreme cases, a person might experience seizures or go into a coma. These are distress signals, and they demand immediate action. Now imagine you or someone you know is showing these symptoms. What do? The answer is simple. Seek immediate medical attention. Don't wait for the symptoms to worsen or pass. Time is of the essence in such situations, and every second counts. When it comes to treatment, there's no one-size-fits-all approach. The medical team will assess the individual's condition and decide on the best course of action. This may involve monitoring vital signs, checking for internal bleeding, or providing supportive care. In some cases, a tube might be inserted into the stomach to pump out the excess ibuprofen. Other times, activated charcoal might be used to prevent the ibuprofen from entering the system. The treatment will depend on the severity of the overdose and the patient's overall health status. Let's not forget that prevention is better than cure. It's always important to stick to the recommended dosage and to avoid mixing ibuprofen with alcohol or other medications that can increase the risk of an overdose. Early recognition and treatment of an overdose can save lives. So, stay informed, stay vigilant, and always use medications responsibly. Long-term high-dose use of ibuprofen can also have serious consequences. Let's delve into that a bit further. When we talk about long-term use, we're referring to regular, sustained use of ibuprofen, often at high doses. This isn't about the occasional headache or muscle ache. This is about persistent consumption, and it's here where the risks really start to mount up. You see, over time, high-dose ibuprofen use can increase your risk of stroke. That's a pretty serious concern, considering strokes are a leading cause of disability and death worldwide. But it doesn't stop there. Heart attacks are also more likely with long-term, high-dose use of ibuprofen. And let's not forget about your digestive system. Ibuprofen can wreak havoc there too, potentially leading to a range of gastrointestinal issues. This could be anything from discomfort and inflammation to serious conditions like ulcers and bleeding. So you see, it's not just about the immediate harm of an overdose. The long-term health risks of ibuprofen are just as significant, if not more so. It's not just about immediate harm, but also about long-term health risks. So how can we use ibuprofen responsibly? Well, the answer lies in being mindful. It all starts with reading product labels diligently. Manufacturers provide essential information on these labels to ensure safe and effective use. This includes the recommended dosage, which should never be exceeded. It's crucial to remember that less is more when it comes to medication. Always aim for the smallest effective dose of ibuprofen. This approach not only alleviates your symptoms, but also minimizes the risk of unwanted side effects. Another critical aspect to bear in mind is the potential interactions of ibuprofen with other substances. Certain medications, when taken alongside ibuprofen, can inadvertently increase the risk of an overdose. Similarly, alcohol can amplify the drug's effects, leading to hazardous situations. It's always wise to consult with a healthcare professional if you're unsure about any potential interactions. In conclusion, using ibuprofen responsibly involves a combination of careful reading, mindful dosing, and awareness of potential interactions. Your health is in your hands. Always use ibuprofen responsibly.